Hi, my name is Dr. Robert Antelak, and I'd like to invite you to our office. At our office, we feel it's very important that it reflects our attitude about our environment that we are all a part of. At our office, we feel it's very important that we take good care of what God's given to us and that we change with what's necessary. And we know that right now, the consideration with emissions and all the things that are happening that in the dental field, that it's actually reflective of that. And so what I'd like to do is just to show you a little tour through our Shelby Township dental office in Michigan, exactly what we're doing. There is really an important need to go digital on everything. So our office, we are completely digital. We are paperless and chartless, and so we don't use any of the paper products, nearly as many as would be necessary if we didn't do that. But one thing I'd like to show you is our digital Panorex. Digital Panorex is great because it captures an image of your entire jaw, and when it does that with about 75% less reduction of radiation, and it captures it immediately. In addition to that, there is no need for the chemistry that's necessary when we take films. Usually when we take X-ray films that you're traditionally used to seeing, it requires very caustic chemicals that are harmful to the environment, as well as when we go in to process them, we breathe some of these nasty chemicals. So what we do is we're able to then take X-rays with no dumping of this material into our water system, which is really a hazard because we all have to recycle this water that we have. And speaking of water, we also do something that for amalgam. Dental amalgam contains about 50% mercury, and when it contains that much mercury, when we remove it from teeth, it can possibly also go into our water system. And what we do is we have a filtration system that will actually filter out about 95% of the amalgam, so it comes as a waste. And it's ironic to me that there are still dentists who put this amalgam into people's mouths. And so we haven't done that for about 8 years or so, and we have a great result with the tooth-colored fillings. They bind to the teeth, and there's no potential for problems with mercury or anything like that. But what that image does that I just showed you, the digital Panorex, is it allows us to immediately to see X-rays such as these here. And we do, this is our system here that we have, and we're able to then go right immediately and to see an X-ray that takes an entire image of the entire jaw. And then we're able to, at that point, even to expand out and see different areas of the mouth and the jaw, and if we have to take wisdom teeth out or place implants, we can do that quite simply. We also have the ability to take X-rays that are detect cavities. And we also do that with an X-ray sensor that is connected directly up to our computer. This is the thing that we put in the mouth, and it will capture the image. Once again, it reduces the radiation level exposure to about 75%, or 75% less radiation that we would have in a traditional X-ray that uses the film. We also use lead shields to protect you, so there's virtually no radiation that even comes exposed. Then what we also do is we take digital photos. I incorporate this with my dentistry to show patients the possibilities, to show them larger images. And so we have on our system, we have the photos and of this patient here. This shows retracted pictures of her that will come up here, and then we can actually show people what's going on. And the benefit of this, and the reason why this is a green technology, is we don't have to use the film that's processed, and so there's no X-ray film that's necessary, and which once again causes caustic chemicals that can go into the environment. Another thing that we do is we use what's called a scavenger. We use nitrous oxide to help sedate our patients, and with that there are some offices that do and some don't. Most do right now, and that's a good thing. And this is the nose piece that you would put on to help you relax with the sedation. But incorporated with that is this unit here that takes any air that's expired out of the nose, will then come through here, and it's vacuumed here and it escapes back out. It does go into our environment. There's nothing we can do about that, but at least our local environment where our patients are and where people have that and where people are present, including our staff, they don't have to breathe this in on a chronic long-term basis. We also use rechargeable batteries. The majority of things that we have in our office, since we're completely digital, is we have wireless, and so with wireless requires batteries. We have about 50 different rechargeable batteries that we have in our office because just the number of things that we have, including our mice and our computers and everything else. So we do that, and that really saves on having to dispose of products that are harmful to our environment. So that's just a few things that we have going on, and I'd like to encourage you to look at our website. It'll kind of give you some more ideas of what's going on, thegentledentist.com, or our office phone number is 586-247-3500. Thank you. Have a blessed day.